The key findings are that the risk of living long and having high medical expenses in old age is a key driver of the savings behavior of the elderly. And household level data sets for those who are age 65 and older, what we observe is that the elderly don't seem to spend down their assets very quickly. And so many people have wondered, why don't the elderly spend down these assets that they could potentially be using to finance consumption? Our research has focused in on the importance of the savings motive for the risk of living long and having high medical expenses. Individuals might potentially want to save for the risk of, for example, living to age 95 and winding up in a nursing home at those ages. Virtually everyone who is 65 or older is eligible for government-provided health insurance called Medicare. However, Medicare doesn't provide for many key services. Most importantly, Medicare does not pay for nursing home stays. Now, there's a program for those who are truly indigent called Medicaid. What we observe in the data is that many individuals, once they pass age 90, do wind up in a nursing home. Furthermore, nursing homes on average cost over $60,000 per year. For this reason, what we observe in household level data sets is that on average for those who live to say age 100, their average medical expenses exceed $30,000 per year. So the real reason for why we might think that health-related reasons are an important driver of medical expenses is that just we observe individuals spending very large amounts of money on healthcare at old age. It would affect their behavior in a few different ways. First of all, if they don't have to save for high medical expenses at a very old age, for example, if Medicare were to cover nursing home expenses, that would be one savings motive that would wind up disappearing. Our model predictions suggest that this is an important that this would have important effects upon the savings behavior of the elderly. Now, there's a second thing that might also happen. Now, individuals who wind up being financially destitute and having high medical expenses coming from, say, nursing home care, these individuals wind up getting free medical care. And so for this reason, Medicaid imposes a very high implicit tax on assets for people with relatively low asset levels and who face high medical expenses. For this reason, insuring all medical expenses could actually boost the savings of the elderly to some extent. However, our findings suggest that the former effect is more important, just the fact that eliminating all medical expenses after age 65 would wind up reducing the savings behavior of the elderly.